Welcome to your 2020 Medicare Updates October Update Training with MAP. Let's dive in. Part A and Part B premiums. Those have not been announced yet from CMS. However, stay tuned for more information. They should be announced by mid-October to November, and your site coordinator will be sure to update you with any of that information, including the blue color job aid. Observation status versus hospital admission. When you're in a hospital under observation status, the cost of care will fall under Medicare Part B. When the beneficiary has been admitted to the hospital, that will fall under their Medicare Part A. The primary issue is that beneficiaries were not being admitted to the hospital, rather being cared for in a hospital under observation, thus receiving bills because it falls under their Part B copayments. They also would have issues if they needed further care in a skilled nursing facility, because Medicare will only pay for those visits after a 3-day hospital admission under Part A. As a tip, please remind your beneficiaries that they can verify their admission status with an admitting physician or hospital staff member. They should receive what we call the MOON notice. Medicare home health care. In Michigan, a pre-claim review is necessary to receive home health care. The beneficiary must be homebound, and the home health care must be medically necessary. All of this is conducted at a provider level, which requires nothing of you as a counselor. But why is this happening? Michigan was identified as an area with a high instance of improper home health care payments. Home health care companies would sometimes provide home health care to people who are not homebound. So to prevent these issues further, Medicare has deemed that Michigan is a pre-claim review area with the following necessities in order to receive that level of care. Healthcare Marketplace and Medicare. Marketplace and Medicare are not designed to work together. When someone becomes eligible for Medicare, they can drop their Marketplace plan in favor of Medicare. In most cases, it is to the advantage of the beneficiary to sign up for Medicare when they're first eligible, because once their Medicare Part A coverage starts, they will no longer be eligible for a premium tax credit or other savings for a Marketplace plan. And if they enroll in Medicare after their initial enrollment period ends, they may have to pay a Part B late enrollment penalty for as long as they have Medicare. And in addition, the enrollment period for them to sign up would occur January 1st to March 31st during the general enrollment period, with the coverage not starting until July of that same year. This creates a gap in their coverage. Let's take a look at our fall timeline. What to expect? Our fall timeline begins in September. In early September, Social Security reviews LIS. In late September, the annual notice of changes and the Medicare new books are mailed out. October 1st, marketing can begin for Part D season, and October 15th is when open enrollment begins. Mid-October is when we see the star ratings, and late October is when non-renewals are mailed out as well as LIS redetermination notices. Our Part B premiums and COLA information should be available in the beginning of November and December 7th is when open enrollment period ends, with coverage beginning January 1st. Here's another look at who sends out what items. Social Security will mail out the LIS redeterminations and loss of deemed status timeframe in September. CMS sends out the reassignments, consistent poor plan notice, the LIS choosers, and the Medicare new books. That occurs between late September and October. The plans will send out marketing materials, annual notices of change, and plan non-renewals in October. Enrollment periods. There is the initial enrollment period, and if you remember from our trainings, that is the 7-month period when a beneficiary is first eligible for Medicare. It is 3 months prior to their birth month, and the 3 months after their birth month. There is also open enrollment period, which is October 15th through December 7th every year. Again, that is where we do our Part D counseling for beneficiaries at our big events. They have special enrollment periods, which can occur from a move, receiving LIS, a loss of coverage, if they're dual eligible with Medicaid. And then you have your annual open enrollment period. Annual open enrollment period occurs each year from January 1st through March 31st. This is the time when Medicare beneficiaries can enroll in Part A or B. However, if they enroll during the annual enrollment period and not their initial enrollment period, they can end up with Medicare Part B late enrollment penalties and have those through the course of their Medicare coverage, and the coverage would not begin until July of that same year, and it would result in a gap of coverage. The low performing plan special enrollment period. People who are enrolled in either a Part D or a Medicare Advantage plan with less than 3-star quality rating can switch their plans during this special enrollment period to either a 4 or a 5-star plan. CMS will send a letter to the beneficiaries enrolled in these low-performing plans to notify them of this SEP available to them. Medicare Advantage open enrollment period. January 1st through March 31st each year, there is a Medicare Advantage open enrollment period where any beneficiary for Medicare that has a Medicare Advantage plan can choose to switch out of their current Medicare Advantage plan to another, or switch back to original Medicare and get a standalone Part D plan. In order for them to partake in the Medicare Advantage open enrollment period, they must have a Medicare Advantage plan by January 1st. The 2020 Part D open enrollment period is the same as usual, October 15th through December 7th. Dual enrolled Medicare and Medicaid beneficiaries and LIS beneficiaries are entitled to a special enrollment period with limitations. Starting January 1st, 2019, beneficiaries that are dual enrolled or have LIS assistance are allowed to switch their plans once per quarter. Those that are at-risk individuals are not allowed to partake in this special enrollment period. Medicare Plan Finder reminders. In order to do a personalized search, it now requires the individual to create a Medicare.gov account. This account will include username and a password. Doing a personalized search will allow them to see the LIS eligibility, their current plan information, and current drug list for all of the medications taken throughout the year. Please be sure to go through this list with them thoroughly to make sure that they don't have information listed in there like a one-time used antibiotic. Usernames and password hints can be documented in the client contact form on ShipTools. Do not keep or write down the username and password. Please only keep the password hint. A beneficiary can also choose to view 2019 and 2020 plan data on the Plan Finder. And as always, remember to poke the bird when using the Plan Finder to enroll a beneficiary in a new plan. Here's a view of what it looks like if you poke the bird. When you're on the enrollment form, the bird will be posted to the upper right corner of the personal information box. When you click on that bird, it will drop down the box that's highlighted in red here that says Partner Information. Please choose the state of Michigan, and in the agent ID, enter in our 800 number. That's 800-803-7174. 800-803-7174. Open enrollment facts and questions. I enrolled a person in a Part D plan or an MA Part D, and he changed his mind. Can anything be done? Absolutely. You can enroll them in another plan. The last enrollment will be the enrollment that takes effect for January 1. Can I enroll a person in an MA only plan with no drugs and a PDP plan? Well, if it's an HMO or a PPO, no. If someone enrolls in an MA, HMO, or PPO, they must get the drug coverage through that MA Part D plan. If it's a private fee-for-service plan, yes, someone can enroll in a private fee-for-service plan without drug coverage if available and enroll in a standalone Part D plan. However, this is not available in all counties, so please be sure to check your landscapes and check in with your site coordinator to make sure that this is available in your county. Medicare Advantage plans and extra benefits. If a person is enrolled in a Medicare Advantage plan and chooses to switch or disenroll, but has a dental rider, vision rider, or hearing rider with that MA plan, that rider will still be in effect. They must call their old MA plan that the rider is through to cancel the rider separately. Medicare Plan Finders. If we are having problems with the Medicare Plan Finder, first we need to rule out any issues with our computer or networks. We also need to make sure that if we are needing to report an issue to CMS, that we pay attention to whether this was a server issue because of peak times. Peak times for open enrollment period are 11 a.m. to 5 p.m. Medicare Plan Finder accuracy. That will rely on us. We need to report these inaccuracies through the Medicare Plan Finder intake form. From that point on, you will want to send that to your site coordinator, who will then help forward that to Lansing. 2020 Part D Standard Benefit Structures. The 2020 Standard Drug Benefits. The standard benefit parameters for 2020 are a deductible at $435, the initial coverage limit at $4,020, the out-of-pocket threshold at $6,350, and the minimum cost sharing in the catastrophic coverage at $3.60 to $8.95. The coverage gap discount, which is what the beneficiary will pay, is now at 25% regardless of brand name or generic. The Part D penalty is based off the national base premium, which is at $32.74. And extra help copayments for those that are institutionalized on My Choice or a home and community-based service plan is $0. For those with Medicaid at 100% of the federal poverty level, the payments include $1.30 to $3.90. For those with full extra help, it's $3.60 to $8.95. Those with partial extra help, where there's a deductible and a copay, the deductible is at $89 and 15% coinsurance. The LIS benchmark premium is also at $30.15. Here's a different look at the 2020 Standard Medicare Part D Basic Benefit Structure. Closing the donut hole. In 2020, beneficiaries who reach the donut hole will only have to pay now 25% again for the cost of their generic or brand name medications. Here's a look at the past donut holes. In 2019, we were at 25% copay for the brand name and 37% for the generics, whereas this year in 2020, we will be at 25% and 25% across the board. A late enrollment penalty. If a beneficiary does not have credible coverage and does not enroll in Part D, then they have to pay a late enrollment penalty. This penalty is added onto the monthly premium for their plan and will continue as long as they're enrolled in Part D. The late enrollment penalty calculation. The penalty is calculated as 1% of the Part D base beneficiary premium, which is $32.74 in 2020. This is calculated for each month that a beneficiary does not have credible coverage and is not enrolled in Part D. Please note that the penalty amount changes each year as the Part D base beneficiary premium changes as well. If someone never enrolled in Part D and needed to do so now, we're going to start counting the amount of months they were without Part D from June 2006 through December 2019. 7 months in 2006 plus the 144 months for 12 years from 2007 to 2019 gives us a total of 151 months. That means it's 151 times 1%, making that 151% of a penalty times 3274. That gives them a 2020 monthly penalty of $49.44. Again, please note that this number can change each year based off of that premium. Part D IRMAA, Income-Related Monthly Adjusted Amounts. Part D premiums will be subject to income adjustments similar to the Part B premium. Beneficiaries with a significant income will pay a sliding scale higher Part D premium. There are 6 income categories, and each category has a set dollar amount associated with it. We currently do not have the 2020 Part D IRMAA or Part B IRMAA information. What's listed below on the slide is the 2019 Part D IRMAA information. As the 2020 numbers become available, your site coordinator will be sure to get that information to you. But, as stated prior, have a look here at the 2019 Part D IRMAA amounts. (2020) LIS and Extra Help. LIS and Extra Help has income thresholds that are based off of the federal poverty levels. The new levels for 2020 will be announced in January, becoming effective in April of 2020. If a beneficiary is eligible now in 2019, they will be eligible for the remainder of 2020 as well. Likewise, your yellow and purple color job aid papers are still effective until April of 2020. Let's take a look at the plans. For our 2020 plans, we now have 30 Part D plans. Out of those 30, 18 of them are enhanced and 12 of them are basic. 4 of them have a $0 deductible, and the lowest premium with a $0 deductible is $62.20. That's an increase of $31.40 from last year. That plan is SilverScript Plus. We have 8 plans that are under a $25 premium. Our lowest Part D premium is $13.20. That's Humana Walmart value. And our highest Part D premium is $105.10. That's the Blue Cross Prescription Blue premium. The average Part D premium is $38.72. And there are now 4 Part D plans with gap coverage. The lowest cost plan with gap coverage is $22.20. That is through Mutual of Omaha RX Value. Here's a look at our Part D LIS plans. These plans have a premium that is at or below the LIS benchmark of $30.15. So if you have a beneficiary who will be enrolled in LIS for 2020, these are the plans you may want to look at to make sure that they have 0 cost in their premium unless they're okay with paying the difference. Special need plans. These are plans that are available to those with chronic illness, those that are institutionalized, and those that are dual eligible. Our chronic illness individuals can have a plan through Align Connect or Erickson Advantage Champion dependent upon their county. Institutionalized have the option through Erickson Advantage Guardian and Align Thrive, again, dependent upon the county in which they reside. Those that are dual eligible now have 7 plan options in Macomb, Washtenaw, and Livingston County, 9 plan options in Oakland County, 4 plan options in Monroe, and 2 plan options in St. Clair. Please see your Toolkit SNP landscape as well as your site coordinator for more information on the plans available in your counties. Marketing guidelines for Part C and Part D plans. Marketing for Part C and Part D, they cannot discriminate based on race, ethnicity, national origin, religion, gender, age, mental or physical disability, health status, receipt of health care, claims experience, medical history, genetic information, evidence or insurability, or geographic location. They cannot target higher income areas. They also cannot state or imply that these are only available to seniors rather than all Medicare beneficiaries. They cannot use the term free when describing a $0 premium, and that would be for LIS individuals that are at or below that benchmark, a reduction in premiums including the Part B buy-down, reduction in deductibles or cost sharing for individuals that are dual eligible. They must include the plan type at the end of each plan on all communication materials, including their marketing material, when the plan name is mentioned. They also can now set up marketing appointments and distribute business cards and contact information for beneficiaries to initiate contact. Prohibition from contacting or conducting back-to-back educational and marketing sales events has been removed. They now can be done immediately following the educational event in the same general location. You can also view this slide for more information on the marketing guidelines, do's and don'ts. Medigap. Let's review the basics and general updates. Medigap Basics. Standardized plans are A, B, D, G, K, L, M, and N. Each have a rating method. They could be community rated, issue age rated, or age attained rated. The enrollment periods for Medigap are as follows. Their open enrollment period, which is the first 6 months that a person has Medicare Part B and is age 65 or over. The guarantee issue, which is from an involuntary loss of coverage or from a trial right due to a Medicare Advantage plan enrollment in that first year of having the Medicare Advantage plan. And of course, they can try to enroll anytime and potentially have medical underwriting. Important Medigap note. Not all Medigap plans sell to those that are under 65 and on Medicare with a disability. If a beneficiary is under 65 and has a disability with Medicare, but then turns 65, they are now eligible for their Medigap open enrollment period. That includes those that were under 65 with a disability on Medicare and had been enrolled in a Medigap policy. Everyone that turns 65 and ages in is then looked at as a regular person who aged in at 65 without a disability, entitling them to the Medigap open enrollment period. For those that had a Medigap policy prior to turning 65, if they'd like to be able to receive pricing for those that are 65 under that open enrollment period, they will then need to reapply for that Medigap policy. Here's a look at page 70 from the Medicare and You book. This goes over the plan information. Again, standard plans, A, B, D, G, K, L, M, and N. Please note that I am not mentioning C or F for the following reason. Effective in 2020, insurers will no longer sell Medigap C or F plans to beneficiaries whose birth date is on or after January 1st of 2020. No plans can be sold to new beneficiaries that are turning 65 on or after January 1st of 2020. Insurers who have enrollees in CNF can keep those current enrollees. And if a beneficiary has had Medicare and is 65 before January 1 of 2020, they can attempt to enroll in a C or an F plan. However, these plan providers do not have to approve it or even hand that plan out as an option. Why is this happening? Well, Congress wanted to level the playing field. There's now no longer any plan that will pay for the Part B deductible. Michigan Medigap Subsidy qualifications. They must be a Michigan resident, and the beneficiary household income must be as follows: $28,102 per year for an individual and $38,407 per year for a couple. Please note that if a beneficiary has applied for this subsidy and their income has increased the following year, they do not have to worry about coming off of the subsidy. They only check the subsidy income information one time, and that is at the point of application. There's also no need to confirm assets, as the only thing they look at is the household income. With Medicare supplements, those can be used towards the AARP United Healthcare plans, Blue Cross Blue Shield of Michigan plans, McLaren Health, and Priority Health. You can see more on the Medigap Plan Finder Excel spreadsheet with information on that. The Michigan Medigap subsidy amounts have been reduced recently because they extended the program through 2020. Now they are extending this program through 2021. Currently, the subsidy amount for an individual who is age 65 to 75 is $35 per month. For somebody who's over the age of 75, it's $56 per month. And for somebody who is disabled and under age 65, it is $110 per month. To apply, they can call the 800 number listed here, visit the MichiganMedigapSubsidy.com website, and or they can call and get a paper application mailed to them from that 800 number. How to shop for Medigap, tools to start. Things a beneficiary should consider. Is it their open enrollment? Do they have a guarantee issue? Or could their health status and age cause them to have medical underwriting? What type of Medigap plan are they looking for? What can they afford? And is customer service an important part for them? Medigap resources to use. First and foremost, absolutely 100% use the Michigan Medigap Plan Finder Excel spreadsheet that your site coordinator gets to you. That is going to be the most up-to-date information. You can always try to use the Medicare.gov Plan Finder as well as the Michigan Department of Insurance and Financial Services as an option, but those are not updated as frequently as that Excel spreadsheet is. Counseling tidbits. How to calculate your savings. When selecting an enrollment in box 6 or 32 on the client contact form, you need to make sure that you're listing the difference between the current plan and the new plan that the beneficiary will have in 2020. To do so, you need to look at the cost of the medication further down on the detail page of the Plan Finder. For more information on that, please see your site coordinator. If they're new to Medicare, we do not have current information as to how to calculate that based off of what our funders, the ACL, would like to have, so stay tuned for more direction. Again, your site coordinator will have that information for you. If you did a LIS enrollment or an MSP application or enrollment, and you check box 11 or 43 on ShipTools client contact form, those savings amounts should auto-populate. Remember to please always report in ShipTools. You want to be able to receive credit for the time that you put in. You have to document that in ShipTools. And always incorporate fraud education into your counseling. It is easier more now than ever before because you have the opportunity to talk to them about the importance of keeping their Medicare.gov account information safe. That connects to their MyMedicare.gov account, which accesses their Medicare ID number, their MSNs, and more. It's a very organic conversation and can be used seamlessly to provide fraud education. As always, poke the bird, and if you haven't already, please take a minute to look at your sign-up sheets that are available and try to help out at a Medicare open enrollment event. Any questions?